Today, let us discuss about the neurosurgeon and the fitness that he has to really maintain to go about his work in a healthy manner. So, what are the things that we do to keep ourselves fit in order to be able to operate on these high risk cases, operate for long hours, take the stress of very serious patients, very sick patients, not one or two, but multiple number of them, and still maintain our sanity and health. And if you want to see more videos on the same lines, dealing with neurosurgery, brain and spine health, and overall health, do subscribe to my channel. This is something that I would like to advise to every person who is living the kind of lifestyle that we are forced to live. So, as far as neurosurgery is concerned, there are 2 or 3 very important aspects. First one would be about maintaining your overall physical health. Now, why is it important? Because it involves standing and sitting for long hours, concentrating on one place and operating. So there are 2 aspects to this. One is the physical aspect, the other is a mental. So first let me talk about the physical one. Over here, what we really need to do is obviously maintain a good posture, and for that, regular exercise so that your muscle is well toned, strong enough to bear that torture of few hours of sitting and standing. So regular exercise is extremely important. Apart from just improving the overall strength of your body, exercise also has impact on 2 or 3 important facets related to the brain. Any exercise that we start or do, whether it be running, lifting weights, or playing a game regularly, involves a lot of physical activity, a lot of movements, and these movements are controlled by the brain. And because of these regular activities, your cognitive function improves, your coordination improves. The brain forms new synapses, new connections. They strengthen the older connections. So overall, involving yourself in regular physical activity not just helps you physically, but also helps you mentally, which is very important from a neurosurgeon's point of view. And as you would realize, it's important from your point of view also to keep yourself healthy physically as well as mentally. So that's one very important thing. So the exercises that I could recommend would be running for a few days in a week. Regular weightlifting and gymming is another thing which would be really helpful. As you age, gymming in fact does hold a significant place in your exercise regimen, because as you start aging, your muscles start degenerating that much faster. So to prevent that degeneration, regular weight training would be something which would help you a lot. So that's one aspect of it. Now the other thing is, when you're operating, you need to maintain that kind of concentration because you're dealing with really vital structures. One mistake and the whole point of surgery goes for a toss. So we should be able to concentrate for that many hours. And to maintain that, we need to start doing meditation, yoga. These are things which would help you maintain your concentration longer and make it more easy for you to go through the whole exercise. Third thing would be coordination of your hands. That's another very important facet. Here, the regular exercise which you are doing comes to the fore. There are few other things which you can actually start doing. Start learning a musical instrument, start brushing with your left hand. These are things which again help improve your coordination, plus helps in making new connections in the brain and thus helps the brain evolve further. And finally, I'd like to come to the most important aspect. Yes, physical health, mental health, absolutely important. But a part of the mental health, which I think is the most important thing for a neurosurgeon, would be our attitude. Our attitude towards our patient, our work, and our life as a whole. And these three things can't be really separated as such, but it is very important that in our minds we're able to kind of compartmentalize things so that there is a clear-cut differentiation between what we're doing inside the operation theatre and what we're doing outside of it. We can't carry the stress and the tremendous expectation that is expected of us to the outside world. Then it would be very difficult for us to really perform well. For that, how I look at it is, do your best when you're with the patient. Give it all, give your 100%. And once you've done that, honestly, there is nothing much you can do beyond that. Beyond that, yes, one thing that I normally do is pray. And trust me, 99.99% of the time it really works. So that's it. A good neurosurgeon needs to be physically strong, mentally strong, and needs to have the right attitude. Thank you. If you like this video, do give a thumbs up. And if you want to see more videos on the same lines, dealing with neurosurgery, brain and spine health, and overall health, do subscribe to my channel. Thank you.